5 minutes, Yoli.
Yes, thank you, Mayor. Since she wanted to come here, we didn't have enough notice to get a translator, so I am going to be her translator. I don't think we need exactly 3 minutes for her, but she needs to be able to talk
Sure,
and then
no,
me
that's
translate.
fine.
And please bear with me because I've never done any public translating, but I think it's necessary. So those of you who do know Spanish, I think you'll get it directly from her, but I'm going to do the best I can, all right?
Okay.
Thank you.
And I just need you to state your name, Yoli, and as well as your guest. So are you going to speak first, Yoli?
She will.
She will, okay.
Yes. My name is Yoli Diaz. I'm Executive Director of CARE, Cancer Aid Resource and Education. ¿Y su nombre?
Buenas tardes, mi nombre es Nayelli Varela.
Good afternoon. My name is Nayelli Varela. And thank you, Mayor, City Councilor, staff, and public.
Bueno, quisiera hablarles un poco de lo que he vivido. Yo vivía en El Paso, Texas.
I would like to speak a little bit of where I've lived.
Y en el 2015 me moví a vivir aquí a Nuevo México por las oportunidades de trabajo.
I moved to El Paso 2009. I think hopefully she mentioned that. And I moved to Las Cruces or to New Mexico in 2015 for job opportunities.
Tengo dos hijos, una niña de 14 y un niño de 8 años.
I have 2 children, one 14 and one 8. Sorry.
Entonces, yo trabajo siempre en las mañanas en el campo y en las tardes de cocinera en un restaurante.
I work in the mornings at agriculture labor and also in the restaurant business in the afternoons.
Quisiera mostrarles unos retratos porque en 2021 empecé a tener problemas de salud.
I would like to show you some photos, some pictures, because in 2021 I started having some health issues.
Así en estas condiciones trabajaba.
In these conditions I worked.
Porque en ningún lugar me querían atender y primeramente pues fue discriminación.
There was no place I could get medical help and I was discriminated.
Y fui víctima de negligencia.
I was a victim of negligence.
El doctor que me vio me dijo que esto no era nada, que de esto no me iba a morir, que era solo mi apariencia.
The doctor said this was nothing and that I would not die from this, that it was just really basically appearance.
Mi piel se caía con mi ropa, se iba la piel y mi cabello se me cayó por completo.
My skin would come off and my hair also fell off.
Y repito, así seguía trabajando, porque él dijo que solo era un hongo, que no tenía nada.
And I continued to work like this. The doctor said it was nothing, and if I didn't mention, he said that she would not die from this.
Esto ya era insoportable, busqué más ayuda y descubrimos que es una enfermedad en el sistema inmune.
She ended up finding a doctor, and they said it was a problem with her immune system, which was actually an autoimmune disease.
Yo pagué todo de mi bolsa, estamos hablando de pagaba hasta $2,000 por un CT scan, biopsias, todo.
I paid for my medical care out of pocket. I paid for biopsy, CT scan, paid up to $2,000.
Y esto fue un año, estar yo pagando, buscando qué era lo que tenía.
This lasted for a year, and she was looking for what was going on with her.
Bueno, ya cuando me di cuenta de la enfermedad es pénfigo, es una enfermedad en el sistema inmune y necesitaba quimioterapias.
She ended up finding out that her problem was she had pemphigus, which is an autoimmune disease.
Y pues empezó todavía otra batalla más porque en ningún lado me aceptaron para darme quimioterapias.
Nowhere was she able to get chemotherapies.
Seguí buscando y ya no tenía ni siquiera opciones hasta que no sé cómo de la escuela se dieron cuenta de mis hijos.
She wasn't able to get any help, and it was actually her school's social worker that ended up helping her.
Y fue que llegué a Yoli Díaz y ella fue quien me ayudó a ir al Alburquerque a recibir las quimioterapias.
And it was through the social worker that contacted me, and I was able to help her get the care she needed, and I got her to Albuquerque.
Entonces yo comprendo que no quería que me las dieran gratis, simplemente que nos dieran oportunidad, que no me negaran la atención. Mis hijos me necesitan.
I wasn't looking for free care. She was just looking for health care, and she was willing to pay it. Nayelli, ¿puedo público hacer un comento de su caso?
Claro que sí.
So she just gave me permission because we only have a minute left. I think it's very important to say that it was the Gadsden Independent Schools District social worker that contacted me. And I was really shocked when she told me that she'd been waiting about a year to get health care. But as soon as she told me what was going on, I immediately knew what was going on. And I was in shock that she had said that she had gone to so many places in the healthcare field trying to look for help. And I let the social worker know, please have her contact me, and we got together because what she needed was health insurance because her autoimmune disease is actually treated similarly as cancer. She needed chemotherapy, and those chemotherapy treatments are extremely expensive. There was never going to be a doctor that could help her because of the extreme expense. What she needed was insurance, and immediately, and that's what I helped her with. When I spoke to her dermatologist, he let me know that if this got into her eyes, this condition, she could become blind, and that made me go into basically begging mode. And I told UNM Hospital and UNM Cancer Center, I'm getting her up there, I'm asking for your help, and they said this is not conventional. I said, well, conventional methods do not work. I'm getting her up there, and I'm asking you to help her. Thank you.
Gracias.
Mayor,
Yes, Councilor.
thank you. Thank you, Yoli, and me da mucha tristeza saber de su condición, señora. ¿Dónde fue que su sistema, your immune system, dónde fue, en qué edad, cuánto hace que sucedió esto? Y le dijeron, por casualidad, ojalá le han dicho, ¿cómo fue que le afectó a su sistema? ¿Qué fue la causa?
Primeramente me dijeron que no había causa y que no había razón, que ya venía en tu genética, que simplemente despertó la enfermedad, pero que ya está en tu genética.
Oh, y trabaja en los files, ¿verdad?
Sí.
Y allí quizá tienen los empleadores deben de tener aseguranza para cuando se lastiman el trabajo. Estoy pensando que quizá el origen de esta enfermedad quizá la ha tenido toda su vida, pero algo tuvo que afectar y tener que causar el efecto que ha tenido. Y estoy pensando que quizá las químicas de los files, y no sé quién es su empleador y no quiero saber, pero para mí que esto es una situación donde puede ver a un abogado y que se trata de compensación de empleo, workers' compensation, y a ver si esa avenida le ayuda un poco, pero me puede muchísimo.
Pues fue lo que pensábamos, porque cuando me pasó esto estaba trabajando en una chilera y me dijeron que a lo mejor los químicos, pero el doctor dijo que no tenía nada que ver, que esto iba a pasar.
If I can interrupt for 1 second, Councilor Flores, can you just recap what you've been asking her, because it's required for us for the...
Oh, for the record?
Yes.
So I'll just ask you in English what I just said. Te voy a decir en inglés lo que he dicho en español. So, or I'll recap. I was asking about, in Spanish, I was asking about what triggered her autoimmune situation and what triggered it. And it was brought up to the doctor. I can't even remember what I was asking, but apparently the doctor told you that it wasn't triggered by the chemicals that are used in the work that you do as a field worker, as in the agricultural industry. And then I recommended or suggest that you see an attorney who deals in workers' compensation, because employers, I believe, by federal statute are obligated to have workers' compensation insurance. And I don't know what doctor told you, but if you have the autoimmune system, it seems to me that it's something that you had, a precondition which was triggered by something. And that's just my thinking. And that was pretty much what I said. Mr. Mayor, thank you.
So, Yoli, do me a favor. Utilizing this example, will you text me? We'll sit down. I'd like to find out what you did to get her the help, and let me see if we can replicate something, okay? All right, thank you. Thank you for your story.
Gracias.
Okay, now it's my turn, the 5. And I know I won't get done, but 5 minutes for me. Good afternoon, Mayor, councilors, staff, and public. My name is Yoli Diaz, Executive Director of CARE, Cancer Aid Resource and Education. I am a proponent of health insurance for all because it allows access to health care, improved conduct, services, and treatment towards patients by providers, and for doctors, nurses, staff, and administration to be paid. I will begin with my ask, so this is the ask, with the goal of health equity. Create the health care fund. Contract with a nonprofit organization to create a program to include staff to operate and fund the health care program. The purpose is to help Doña Ana County tax-paying residents receive needed health care services for a major health crisis who are denied or delayed health care due to being ineligible for standard health insurances or marketplace plans. City of Las Cruces can help its tax-paying residents receive needed health care by both its city charter and the New Mexico Constitution. The anti-donation clause does not prohibit the state, counties, and municipalities from making a provision for the care and maintenance of sick and indigent persons. And if you ask about funding and how to create the health care fund for the health care program, you could use the Telshore Fund, Cannabis Gross Receipts Tax, the General Fund, any fund available, or allowable, possibly a partnership with Doña Ana County, and you can create a task force for discussion, criteria, and implementation. Due to time, I will not go into the complicated and multidimensional detailed issues that create the injustice, segregation, and discrimination I witness in access to health care. The Affordable Care Act, enforcement of New Mexico statutes, the Doña Ana County Healthcare Assistance Program, which include treatment and resources regardless of immigration status. I will question, though, why does our state of New Mexico, being the number 3 state in the nation, receiving the most federal funds per resident of $8,692? Why do they not ensure that every New Mexico resident, both the U.S. citizen and non-U.S. citizen, are covered? Non-U.S. citizens, known as the undocumented residents, are included in this resident count. I have witnessed the premature deaths, and I've met the American children left as orphans because their parent did not receive the health care they needed when they needed it. I feel that our government needs to consider all tax-paying residents and provide resources to all taxpayers. So Doña Ana County is on red alert, and there's 3 reasons why. 1, our demographics and social determinants of health. Doña Ana County has the 2nd highest population in the state. We have a high Hispanic population, high poverty, low income, high uninsured, high cancer deaths, high diabetes deaths, and no nonprofit hospitals. So the second one is we have 3 private for-profit hospitals. For-profit hospitals are owned either by investors or the shareholders of a publicly traded company. They have higher charged cost ratios, which are markups, and these higher costs make it difficult for many. Border region is the third reason. We have a higher rate of undocumented residents. Undocumented residents are not eligible for Medicare. Undocumented residents are not eligible for Medicaid. Undocumented residents are not eligible for New Mexico Marketplace. Undocumented residents experience roadblocks to travel to nonprofit hospitals like UNM Hospital and UNM Cancer Center, where life-saving treatments can be found. There are Border Patrol checkpoints to the north, west, and east, and 30 of our 33 counties in New Mexico do not share this problem. Our border region creates a higher rate of inequality. It contributes to the injustice, inequity, segregation, and discrimination. And I have been talking about some issues identified with Memorial Medical Center, the lessee of City of Las Cruces and Doña Ana County. MMC is the only hospital that provides chemotherapy and radiation treatment for cancer patients, so if you have no health insurance coverage, there's no service. Memorial Medical Center is contracted with 2 New Mexico Marketplace plans, leaving almost 75% of Americans uninsured. They have no known charity programs. They have high charged cost ratios, which is known as markups, price gouging. They inflate estimates, then give discounts. And that's all I have to say because I have 5 seconds. So what I do want to say is please, thank you for consideration, and I look forward to positive results. Thank you.
Thank you, Yoli. And as you and I had this discussion, we'll take a look at the county's indigent fund, which actually taxes city residents as well, because they take 1/8 of our gross receipts tax and puts it in that account. I believe there's usually $5 to $6 million per year, and I think that, and then what they usually do, whatever, they distribute it to various organizations and also to AMR, but then they take it to the state, who gets tripled the dollars. But ever since the Affordable Care Act was put into place, that was meant to provide insurance for everyone. So that would be a big starting point, but we'll have that discussion if you can text me, and we'll, now, we can, but I want to focus a little bit on Nayelli, what's her name? So we can see how we can replicate that and use that as a building block and move forward.
Yeah. One last comment. There was going to be another patient that was going to come, but her client, she had to take her to El Paso for medical care. I don't know if she made it. I'm going to look back, if you don't mind. No, she didn't make it back, but I do thank you, and I think that if we're going to think of our community, it starts with our city and county. Thank you.
Thank you, Yoli. Okay, I think this concludes our public participation. So thank you, everyone, for